Shio, good afternoon. I'm joined here today with Sheena Kanat. Sheena, how are you doing?
I'm doing good. How are you?
Doing well, doing well. So tell me a little bit about your job, what you do there at PHHS.
So my name's Sheena Kanat Lambert, and I'm the Public Health Director. I oversee all the public health programs.
Wow,
and
that's a big duty.
yeah, it is, and work with some phenomenal programs.
Good.
That are working hard during this COVID.
Right now,
response
during the
time.
pandemic,
Yeah.
they're all busy. And thank you so much to the frontline employees, especially public health employees,
Absolutely.
for all the work they're doing right now.
Absolutely.
So how busy have you been?
Busy.
Really busy.
Really busy. Yeah. Pretty much from the start of the pandemic until now, and I don't see it letting up for.
It's going to be a minute.
It's going to be a minute. So.
Yeah, it is, unfortunately. And I come on here with Dr. Bunyo quite a bit, and we talk about precautions that can be made to kind of mitigate the spread of the virus and such. And so what we're here to talk about today is kind of the outcome from that and starting to see like the results of some of those things and what we can do to better understand what we're seeing with our numbers and our data. And that's where you really play into this, right?
Yeah, I mean, I have to, give credit to our Zology public health teams and our partners, Cherokee Hospital Authority, and our epidemiologist as well, who does a really great job with data collection.
Good.
So they all work really hard, and it takes a team effort to get to this point to be able to pull that data for the community.
I was going to say, this is almost live speed, and you guys have a cutoff time, and I know I'll get into the weeds a little bit with this later.
Yeah.
But you guys are really constantly looking at the data and seeing where the trends are and where to make adjustments at with policy.
That's important, right? And true public health, and making sure that we have situational report, weekly, and for this it's Monday, Wednesday, Friday.
Right.
Making sure that we are seeing trends and hopefully sort of mitigating those trends.
Well, good. Well, thank you guys for your hard work. Now let's dive into this a little bit, into your report.
Sure.
What are we seeing on the first page of this thing as it goes out to the public?
Yeah, so the first slide is a total positive COVID-19 patient outcomes. And as I mentioned before, this entire PowerPoint presentation is updated every Monday, Wednesday, Friday.
Okay.
And this is sort of cumulative. Some of the boxes that you see sort of going across, the current hospitalized, the deaths, the active, the recovered, and positive. They're in all color-coordinated combos. This is a cumulative number from the start of the pandemic.
Gotcha.
So we currently have 3 hospitalized as of today, noon today.
Not that that's good, but that's a decrease from the last number.
Right.
Okay.
Yeah, I think it was 8 Monday. So that's really good that folks have recovered. And we've had 4 deaths, unfortunately, during this pandemic. We have 97 active.
Okay.
Meaning those are folks that have tested positive and are currently in their homes in isolation.
Okay.
We've had 372 recovered.
Okay.
So that means that they have been positive and they have came out of their isolation and are doing better. So
that's excellent.
It is great. And then the positive, we have 473, and this is a cumulative number from the beginning of the pandemic.
Okay.
That's how many we've had total. And then if you look down, sort of under the columns, under the currently hospitalized, it has a little title there, since noon of October 26th. So this means since Monday at noon, since it was last updated, the dashboard. We've had no deaths, which is great.
Right.
We have had 33 move into newly recovered. So that means that they were positive, and now that they're out of isolation.
So they spent their isolation time, and now they're out of isolation and considered good to go. Okay.
And then, unfortunately, we've had 8 new positives since noon on Monday.
Okay.
If you move over to the right there and under testing data, this one's an important one because we've had a lot of questions about this one. The test administered, 11,882. A lot of people think, well, that's just one test. But actually, some folks have been tested 5, 10, 15 times. I mean, literally. So that's a cumulative number.
Okay.
So That's important. We've had 10,935 negative tests.
Okay.
And the pending tests, tests are taking about 2 days to get back, especially if you have a PCR test, which is sort of the gold standard in testing. So we really, really advocate for anybody to take the PCR test because it's the most accurate.
Gotcha.
And there's 565 folks waiting
for testing. Mm-hmm. So those are likely tests that were done in the last week.
Yes.
We're just waiting for those results to come back.
Exactly.
Oh, good. Now, the new positives number of 8, we've been seeing numbers up in the 20s and 30s, and to see 8 is a really promising number and saying a lot about hopefully the efforts that we're making in the community.
Yeah, that's good.
Okay, what's the second slide talk about?
Okay, so the second slide, this really talks about the total COVID-19 positive patients by community.
Okay.
And so, when we first started talking about this dashboard, multiple entities were involved. Like, it was really important, I think, for the community to know how many people were positive in each of those communities. And so we wanted to make sure that we were capturing that from the get-go. So this is a sort of a summary of all of those positives per communities. Obviously, you see the biggest numbers in Birdtown and Wolftown, which those are our two biggest communities here on the boundary. But it's sort of nice to see, and over time you can actually look at previous dashboards to see where that's increasing or decreasing in each of those communities.
Gotcha. And now I see that below that you've added some of that since the last.
Mm-hmm. So you can go back from Monday's dashboard, for example. That's again, this is all on the released on EBCI PHHS Facebook page.
Correct.
And also the One Feather as well. But we can sort of look at trends and see where we can make improvements to mitigate.
Now, the other category, as it's mentioned at the bottom, it includes positives residing outside the communities or those who did not report a community. Are there reasons that folks wouldn't report their community?
They may be, they may not self-disclose that. And there may be situations like you may have workers who are employed with tribal entities.
Okay.
That do get tested through our system because they work with tribal enroll members, and so that's one example of something like that.
Okay, let's talk about the third slide here.
Okay. So the third slide is the COVID-19 positive patients by age group. This one's really important because over time, again, you're able to see trends in age groups that are becoming positive. And if you notice, I know Dr. Fauci has talked a lot on the news about age groups, sort of that Generation X age group, which is the 20 to 29-year-olds. That's, where our highest positive rates have been.
Gotcha.
And this is one way that, public health officials really look at, where can we come up with some strategies to help mitigate
that particular age group
gathering and spreading the virus. So
you can see there that our 20 to 29-year-old group is almost higher than our entire 50 to 80-year-old group combined there. We add those numbers together, they're almost caught up with that.
You're right. And, I think it's important to note that, a lot of Cherokee families are multi-generational homes. And so, if different age groups are all proactive, they can really help the spread to those elderly family members that may live in the homes and really impact those numbers as well.
So it's important that if you do live in a situation like that, that you're you're not the one out getting infected, so that you're not putting yourself in a position to be infected. That's not necessary. We all know that we have to shop for food and that we have certain things we have to do.
Right.
But if you can mitigate that through any other means, then that's the best way to do it, especially in those situations.
Absolutely.
Okay. Good. Let's talk about the fourth slide.
So this one is COVID-19 positive patients by gender. And this sort of, again, going back to the slide that we previously went over, it just goes a little bit more in depth.
Okay.
And it includes separation of gender, male and female.
Gotcha.
And so, is it, again, we can use this for mitigation efforts and really see, is it females that are spreading? I mean, what's sort of the approach and where we should focus our efforts.
Gotcha. Very nice. All right. Total positive, total recovered, and current active cases.
So this one's pretty straightforward. This is just, over time showing, the blue line obviously shows the positive rates since the start. It looks like 620, 620
Right.
through 1020, 320. And obviously it's went up, as we know. But the red or the orange, I guess the burn orange, is showing the recovered, which is following in suit, which is good. And then our active cases are sort of below that. So
I got you.
They're trending in the direction in terms of what we would hope is all of the ones in the green move up to that burn orange line and recover. And our positive, all three of them, of course, if our numbers go down, they all go down, which is good.
Okay.
Which we would like to see.
So eventually what you would probably see is some kind of a plateau, and that would mean that we've stopped getting active cases of it and people have recovered, and then our positives kind of flatline.
Yeah, we would like to see actually all three of these go down because...
Yeah, let's flatline that at 5.
Yeah.
Right where it's at would be ideal, but that'd be great if we don't have to add any more height to that.
Right.
Okay.
And for now, what we hope to see is those actives becoming that recovered category.
Yeah. Good deal. Now this is the slide that's had the most attention because this talks about, and you'll have to get, this is the one that's real confusing, but by the same token provides a lot of insight as to what we're doing with our cases per 100,000.
Yeah, so this as you mentioned, it's COVID-19 daily newly reported cases per 100,000. It's a 7-day rolling average. And if you notice in the chart, there's sort of 3 categories on the table here. The one in red is our positivity rate.
Okay.
The one in blue is North Carolina state as a whole. And then the one in green is Western North Carolina region.
Okay.
So as you can see, we're really high.
Compared to the state and Western North Carolina.
Exactly. We're in the red. We're actually, in the state, we're a really hot spot in the region right now in terms of cases. So it's really important, again, and I know that folks are getting tired of hearing it because it's really a challenge, but, making sure to, try to stay at home and
what efforts can we take?
And not attend social gatherings. Our for the month of October so far, our testing positivity rate is about 10%. So
what does that mean?
So what that means is if you attend a family gathering of any sort, a birthday party, a funeral, a cookout, a wedding, and there are at least 10 people there, chances are that at least one of those people have COVID.
Okay.
So if the numbers go up and you're around even more people, say 20, there's at least 2, and so on and so forth.
And so then the odds of you running into it's a lot easier.
Right.
Wow. So
it's really, really, really important. I think this one is important for the community to see
Right.
and know how important to be just really vigilant about wearing their mask and waiting 6 feet apart and washing their hands at all times.
And you can see for a long time on this one, we were, it looks like up until about the end of September, which would have been test results probably from Labor Day coming in, that we were there on par and even doing better than the state and Western North Carolina in general. And then it looks like it just shoots through the roof.
It does. I will have to say, I have to say during this response, we've been really blessed as a community. Our testing penetration has been 8 times bigger than the state.
What does that mean? Break that down. What does 8 times better mean?
So we're testing 8 times more than the state is.
Okay.
And the counties.
So we're able to reach more into our community and make sure we know where this is at and what's happening.
Exactly.
8
and that's
times
really
better.
important.
That's real important.
It's
yeah.
really important. So, you know, it looks like our numbers have dropped. Obviously, we just had 8 new positives instead of from Monday we had 43, which is, you know, over the weekend. But we would like to see that number continue to drop.
So what will it take to get this red line back down into the orange and yellow ultimately?
Personal responsibility from each community member to wear their masks, wash their hands, and wait 6 feet apart, and not attend family gatherings.
That's a big thing, and it's a message that we're sharing.
Exactly. It's really, really important, especially for those that you don't reside in the home with and you're not around. You want to make sure that you wear a mask.
Now, even having another family come over with their kids to play with your kids, that's a gathering, right? Right.
Yep,
and so we're trying to mitigate that and not recommend that right now as well.
Yep.
Until we get this to a place, like you said, when you're at 10% testing, that's you get a couple of people together, and you've likely got it in your home now. If we can get that way down and we can get this number down, and this number is derived, again, as you said, from 7 days of positive tests. Mm-hmm. And so what is that number right now? I can barely see it. 86.9?
86.9, yeah.
So in the last 7 days, we've had 87 cases.
That's correct.
Per 100,000. And this is derived through some kind of formula because we don't have 100,000 people here. But
that's correct.
That would be the idea. Is if we had 100,000 here, we'd have 86 of them right now new this week.
That's correct.
Okay.
And we sort of follow in suit with this because a lot of the data that's out there in terms of COVID, counties sort of have this, 1 case per 100,000 on a 7-day rolling average, and it's easy for us to sort of compare.
Right. That way.
So we thought that was really priority, and it's a great visual to see where we are in relation to the counties in Western North Carolina region as a whole.
Good. Okay, that's good. And then our final slide. Yeah. What is this one about?
So this one's actually fairly new. I think it was added a few weeks ago.
Okay.
So I know that some of the public health terminology can be a little confusing to folks.
Right.
And isolation is a confirmed positive.
Okay.
So when people... and a lot of times people get them interchanged, quarantine and isolation, and they mean 2 different things.
Right.
So this slide talks a little bit about those direct contacts that are currently being monitored and under home quarantine.
Right. Okay.
So they've been in contact, they've been listed as a direct contact of a positive that's already in isolation.
Gotcha.
And it sort of breaks out per age group. It could be that, you have a family member that the mother's positive, and her, of course she's going to be around her children, so they're in quarantine as well.
Gotcha.
In the home. So we have a total right now of 166, and that's separate from those that are in isolation.
Okay.
That's a separate number.
Let me ask you this. This is the part that I'm interested in.
Yeah, sure.
The seniors there, the 60 and up.
Yeah.
It looks like there's 9 people. That's the number we'd like to keep at 0, right? I mean, that's the folks that are most at risk with this.
Yes, absolutely.
And so for folks out there that are hearing us, if you can avoid your at-risk seniors at this point, that's the best mitigation. If you've been around if you've been at home with them and near them, they're in your circle, that's fine. But if you haven't seen them in a couple of weeks and you've been out, you might want to just hold off a little bit longer until we can get this under control, correct?
Absolutely. Any way that you can mitigate and stop the spread, especially to that age group or in the most vulnerable. You know,
right.
You don't really have to be that age to have, underlying health issues, and viruses don't discriminate.
They don't.
And sometimes you can be absolutely healthy and still be impacted.
Right.
We just don't know. They're still learning at this point.
And we're still, Dr. Booney and I talked about, we're still learning about the virus. We don't even know the real long-term effects of this yet. And so we don't really know at any age that it's good. We don't agree that at any age it's good.
Right.
But especially, those vulnerable or have underlying health conditions, that's the folks we need to really take care of and keep a distance from as long as we can.
Right. And again, it could be a lot of these, we want to reflect this in a slide, and this slide's important because, in the number, because this 166 could very well turn into positive.
Right.
Because they've been directly exposed.
And that's kind of how we're treating it, right, with the quarantine.
Exactly.
It's like, we're just going to assume for everybody's safety here that you've got it.
Exactly.
Do you do the testing then, or do you have a 5-day wait? We'll test you, and then you're coming off of this once we know you're good.
Exactly.
Okay.
So if they've been a direct contact, there is a little lag time because we really make the recommendation for direct contact to test between 6 to 8 days.
Okay.
Of their last exposure. So that's one of the reasons we have this slide.
And then they do the mandatory quarantine either way. So they're not coming off of this till the 14 days is over.
Yeah, and what we're seeing is a lot of folks that are in this 166 end up being positive.
Okay.
And that's where the public health role really comes out.
Yes.
It's really stopping the spread and stopping surges from happening.
Yeah, and you've got your hands full because of the nature of this virus. I mean, with its incubation period, that 14 days is a long time for this thing to be living somewhere and moving.
It is. Very.
And so, you've got your hands full.
Yeah.
So, folks listening at home, what kind of advice do you have for them, after you talk about this direct contact piece? And these numbers are going down as well, it looks like. I think last week or so it was around 300 and more. And 166 is a nice number to see people coming off quarantine. And with our positive rate going down, it means something good.
Yeah.
We got to keep trending it that way, right?
Exactly. I would just, again, I know that people are getting really, we've probably said the 3 W's 150 times, but
I know.
It's so important
it is.
because it's scientifically proven to prevent the spread of the virus. And I would just, really stress to be vigilant about wearing their mask and not getting together.
Yeah.
And even though it can be very challenging, and I know for so many people, just seeing the bigger picture and trying to prevent that.
At some point,
spread.
what would you say to somebody? We have to go to the post office. We have to go get groceries. What do you say to folks that and naturally we'll be around people. What do you say to folks that are having to do that? How can they best protect themselves?
Follow the 3 W's.
3 W's. I got a couple of things of sanitizer in my car, and if you need a bottle, let me know. I've got some in my office I can share.
I have so much on me.
Yeah, but and it does. It seems crazy, right? It seems it's a crazy time. But that simple stuff like that: wash your hands, keep your distance, wear your mask, take care of your elders. It's just who we are as people. So let's just do that for a few more months. See if we can't get these numbers down and flatlined. Yeah. And then, some sense of normalcy will start to creep back in. But I don't think that do you think we're going to get back to a place where we're just doing what we were doing before in the next little bit?
No, I think we're in this for a while.
Yeah.
Until I know that EBCI PHHS has released a survey here recently.
Right.
We're trying to get a really good, some feedback on how the community feels about the vaccine itself.
Right.
The information that we have disseminated throughout the pandemic. And so I really encourage folks to go on there and take that survey.
Do the survey.
Because we really do value every person's input, it's nice to know how many people get their flu shots and things like that. But any way that we can help, we'd be glad to do that.
And I won't put you on the spot because you're a public health official, but I do think that the best way to get back to some normalcy and to keep our economy strengthened up and get ready for the next year is to do what we're saying right now. Because if we can tackle it right now in our winter month and as the flu's coming on, but we don't have a lot of economy happening right here right now, let's take advantage of that. Fine, let's just quarantine ourselves. Let's practice safe habits. Let's take care of it now. And next spring, hopefully things can open right back up and we can rock and roll. Of course, still practicing safe guidelines and such, but it'll be the best sense of normalcy. If we let this thing get out of control, things will have to change, and it can truly disrupt the economies and closing shops. And I mean, that can really affect people in a bad time of the year. And it already happened once, so let's see if we can't just take care of it now.
Yeah.
And again, I don't want to put you on the spot. I know you're a public health official, but
I agree.
that's just my opinion.
And I think the important part about the 3 W's is that's really how we get the economy back open.
Right.
If people wear their masks and stay 6 feet apart and wash their hands, all of them, that's actually a strategy to open the economy back up. Yep. So I think there's a misconception. I think that people think that wearing their mask is for their protection, and somewhat of that's true, but the bigger piece of that is that you're protecting the people around you. Exactly. Because and that's the bigger piece. And that's what's so frustrating with this is that as Cherokee people, that's part of our value system is to protect the other people and not be selfish about it. And so to wear your mask is protecting me. Thank you for those of you that wear your mask out in public. And for those of you that don't, I'm not trying to shame you. Just consider that. Consider that, you might pass an elder and you don't want to pass something on to that elder. So. Exactly. Cool. Well, thank you for coming on, Sheena. And I really appreciate, again, the work that you and your team are doing, all of public health. I know the whole Eastern Band is trying to figure out a way to tackle this. It's a virus. It's nature. It's always going to be hard to kind of win that battle. I don't know if you ever do. But we can do our best as Cherokee people to play our part in our personal responsibility of taking care of us and our families directly through the things you've talked about. But thanks for sharing what this stuff is. And we'll, as things change, if you need to come back on and explain more, we certainly are here for you to explain that. Thank you for having me. Yeah, I really enjoyed it. Thank you so much.
We'll see you again very soon. If you have questions, post it on the Public Health Facebook page where this is playing. You can also reach out to my office or anyone involved in public health. And we'll be happy to answer you. We'll talk to you again soon. Data Dog, you.